Hello. Welcome to the latest edition of Colorectal Cancer Canada's Tush Talks. Colorectal Cancer Canada, or CCC, is the nation's leading patient support group for colorectal cancer, and Tush Talks are our way of providing free, useful information about colorectal cancer and other cancers to you, whoever you are. I am Carl Binman, I'm your host, and today's Tush Talk is about the ctDNA test, or the circulating tumor DNA test. To talk about this with us, we are joined by Patil Mksyartinian, who works for Colorectal Cancer Canada as a program manager. Patil is a graduate student at the University of Waterloo and holds a master's in public health. Patil's work at CCC focuses on developing educational materials and conducting research to improve patient outcomes for colorectal cancer patients in Canada. Patil, thank you so much for joining us. I'm really excited to have you. How are you doing today?
I'm great. Happy to be here.
Awesome. Is it rainy where you are? It's rainy where I am.
Nope, it's all good.
Great. So ctDNA, circulating tumor DNA. A lot of concepts in there. Can you tell me a little bit about what a ctDNA test is?
Of course. So when someone has cancer, their tumor can shed small pieces of DNA into their bloodstream. So these small pieces of DNA are known as ctDNA. To put it simply, you can think of it like the breadcrumbs that the tumor leaves behind as it grows and changes.
Right. So then why would we be testing for this breadcrumb trail?
So for ctDNA, it can be important for kind of checking for a concept known as molecular residual disease, so MRD. MRD refers to the small amount of cancer that can be left in your body even after you're done treatment. So this can't really be seen through traditional, things like imaging or exams. So ctDNA testing can be used to kind of help check for these small amounts of cancer that's left in your body.
Right. What differentiates a ctDNA test for MRD from like other kinds of tests that you might be taking to determine whether you have cancer or how your cancer is progressing?
Well, there's other types of tests like the carcinoembryonic antigen test, so the CEA test. So this test is a blood test that measures the amount of CEA protein in your blood. So this can be used to see if your treatment is working or if there's reoccurrence after treatment. So I wouldn't say that the I guess ctDNA testing replaces the CEA test, but the difference lies in that the ctDNA test is more accurate and is more sensitive to detecting these small amounts of cancer.
What is it about the test that makes it more sensitive?
Well, for the ctDNA test, there's different testing available. So there's the Signatera test, which is a type of ctDNA test. So this test is custom designed based on a patient's unique set of tumor mutations. And this allows for these small amounts of cancer to be accurately detected. So with the ctDNA test, it's more accurate. So that allows for, doctors to check for if there's a higher chance of reoccurrence or if a patient's treatment is working well.
So when you say that it's more accurate, like how accurate are we talking?
In some studies, it has shown that the ctDNA test, tests like the Signatera test, are 88% accurate in detecting colorectal cancer reoccurrence in patients with stage 2 and stage 3 colorectal cancer. So this is more accurate compared to the CEA test, and it's more reliable.
Okay. That's really interesting. So the test takes like the signature of your tumor to be like, we're looking for these specific little things. So this isn't a test that helps like determine if you have cancer. It's really a test like once you have cancer, once you're in treatment, it's a way to like sort of monitor how the treatment is progressing.
Exactly. It's very useful for checking for treatment response, cancer reoccurrence. For example, if a patient is, a stage 2 colorectal cancer patient and they've completed their surgery, maybe they're set to start what's known as adjuvant chemotherapy, so chemotherapy after surgery. They might want to complete a ctDNA test to see if they still have cancer left, because they might not have to, I guess, proceed with adjuvant chemotherapy. They could think of other options, such as just monitoring the amount of cancer that's in their blood through ctDNA testing. So it can kind of provide, I guess, patients the option to see whether, chemotherapy is right for them or whether other treatment options are right for them.
Right. So it's not like it doesn't replace other tests. It serves to kind of provide additional information for the specific like course of the disease and making decisions there. Okay, that sounds really useful. If I'm a patient and I am like, this sounds interesting, how do I get this? What would I do? Would I go talk to my doctor? Would I say, hey, ctDNA, what's up with that?
Exactly. I think it's really important for patients to self-advocate for themselves and open up the conversation with their cancer care team, with their oncologist, that, they're interested in learning more about ctDNA testing and whether they're eligible for ctDNA testing. And also, it's also important for patients to consider the cost of ctDNA testing, because ctDNA testing, specifically the Signatera test, is not covered through, public, provincial, and territorial health insurances. And it may be covered through private insurance partially, but there is a substantial cost associated with these tests.
Right. Is it not covered because it's like a new sort of test?
Um, I believe so. Yeah. So it is more of a newer test. It's been out for the last, I believe, 1 to 2 years in
Okay.
Canada.
Right. So something actually that we had a question about was like kind of going back to talk about accuracy. A patient had asked us if your ctDNA test comes back positive, but the other tests that you've taken, like the CEA, are negative. It's a more accurate test. What then do you do with this different result from a more accurate test?
Yeah, so if your ctDNA test comes back positive and your other tests have come back negative, such as your CEA test, then it's really important to consider that this test might be more accurate in detecting the small amounts of cancer, or that you're at a higher chance of reoccurrence if you were diagnosed, for example, with early stage colorectal cancer. So at this stage, your doctor might want to continue to monitor your ctDNA levels to kind of assess how well your tumor, for example, is responding to treatment.
You say continue to monitor the ctDNA levels. Like, what does that mean? Is this like a test that you do once and it continues to tell you how it's doing, or is it something you have to do again? Like, what is the course of the test? How does it operate?
So with the test, you have to basically start with the test you basically get an initial blood and tissue sample. So that's how the test is initially done. You get a blood and tissue sample, and then any follow-up testing only requires a blood sample. So the test, usually for follow-up testing, it's done every 3 months. So it is a test that's done more long-term to monitor how your ctDNA levels are kind of changing.
Right. And again, this is done in concert with other tests and with your treatment, sort of to help provide a fuller picture of how things are going, right? Okay. So the ctDNA test, it is something that colorectal cancer patients can pursue. Is there anybody who this isn't really a useful test for?
Um, for the test, it really depends on each patient. For each patient, it will kind of differ. Currently, ctDNA testing is used for those with solid tumors, such as colorectal cancer, and the studies have primarily shown that it provides a high accuracy for stage 2 and stage 3 colorectal cancer patients. I would say for stage 1 and even for advanced stages such as stage 4, it could be beneficial. For, stage 1, for example, a patient might have, anxiety, so they might want to check if they are at a higher risk of reoccurrence. For stage 4, it could be beneficial for monitoring how well they're responding to treatment.
Right. Sort of like ask your doctor what the proper course is. Kind of how it often is. Because this is something new, though, is this something that doctors are aware of?
I would say it really depends on the doctor. I mean, they might be aware through attending, webinars or informational sessions, but mostly I find that they become aware through their patients. So it's really important for the patients to bring this to the attention of their doctor and to say, okay, there's this thing called ctDNA testing. Do you think this is beneficial for me? Am I eligible for it? So it's something that I feel like it will be more commonly known as kind of patients are kind of bringing it up to their doctors.
Right. Which also theoretically could like help contribute to more awareness and maybe coverage from, funders and stuff. Yeah, although I do just want to add something that you mentioned webinars, information sessions. Colorectal Cancer Canada is actually going to be hosting a webinar on the 14th of March from 7 to 8 p.m., hosted by the president of CCC, Barry Stein, with Dr. Minetta Liu and Dr. Michael Raphael, who are experts in ctDNA testing, specifically the Signatera test. So if you do have questions and need more information than what we're providing, you should definitely go check that out. I guess something that on the broader level of this is a test that uses sort of data from the individual tumor that's based on an individual patient. Why is that better? we do hear a lot of talk about like personalized medicine and biomarker testing and all that sort of stuff. What is the benefit of that approach?
I find that with the personalized approach, it really helps for patients to discover more like actionable treatments. But I will say with the ctDNA test, it is different from biomarker testing. So it's not looking for actionable mutations or personalized treatments. It's more so looking at the patient's unique tumor signature. So that's how it's kind of checking for that molecular residual disease. So that small amount of cancer that's left in your body.
Right. So yeah, so this isn't something that is a treatment. It's to see how your treatment is working.
Exactly.
Right. And like you said that it was expensive. Do you know what the cost is for this?
In Canada, the first test, so the initial test is around 4,500, and any follow-up tests are an additional $2,000.
That's expensive. So say I'm a patient, it's not covered by my insurance, and I would like to explore how to get access to it. I know something that we at Colorectal Cancer Canada often do is we help patients get in touch with clinical trials that might have treatments or testing that they could use in the course of their treatment, so they have early access to potential drugs that'll come later on. Are there any clinical trials active currently for ctDNA or for Signatera?
So currently, during the time of this recording, there are a few clinical trials focusing on ctDNA in Canada, and there are some that focus on ctDNA as more of like a secondary point. For example, there's one clinical trial focusing on colorectal cancer patients who underwent surgery, so stage 2 or stage 3 colorectal cancer patients, and they're basically followed for a minimum of 3 years and up to 5 years to check for reoccurrence. So there are some clinical trials, for example, exploring the use of ctDNA testing for cancer reoccurrence. But I would definitely say if a patient is interested in joining a clinical trial, they should ask their doctor, or they can email us if they're interested in finding out more information about available clinical trials.
Right. And they can reach us at our website, colorectalcancercanada.com, or by emailing us at info@colorectalcancercanada.com, support@colorectalcancercanada.com, or any of our social medias where we're at Colon Canada or Colorectal Cancer Canada. The duration of the clinical trials made me think of something that I was wondering about the ctDNA test. You mentioned that sort of when they're in the course of their treatment, patients should be getting every 3 months this test to measure the levels. After their treatment is finished, when they want to continue monitoring how the levels of ctDNA are, what's the suggested duration that people continue to get tested in this way?
So the duration of the ctDNA testing will depend on the patient. So this is something that an individual's cancer care team would decide. It really depends. So, for example, for like a stage 2 colorectal cancer patient, it may be monitored for, a few years if they want to check for reoccurrence. But again, the chance of reoccurrence and the risk for reoccurrence and the benefits involved, that kind of all depends on each patient, and it's really important for, a patient to consult their care team to find out what's right for them.
You had mentioned the differences between the CEA test and the ctDNA test. Something that is maybe not super clear to me is the use of each test in terms of like measuring changes in cancer or chance of recurrence over time. Why is the ctDNA test more able, or is the ctDNA test more able to predict or track reoccurrence?
For ctDNA testing, I believe it's more accurately able to, and earlier able to, like detect recurrence, is due to the fact that it's kind of looking at the changes of cancer in your body over time. So with the CEA test, it's more of a snapshot. So, you're doing this blood test, once every year or so, and it's checking if you have the CEA protein in your blood. Whereas for the ctDNA testing, I mean, you're doing follow-up testing, and that's basically being used to monitor your changes in ctDNA over time. So it's checking how those levels are changing. And if those levels are going up, it indicates that you have a higher load of, cancer left in your body, or if those levels are going down, it means you have a kind of lesser amount of, cancer left in your body. So you have a lower risk for cancer reoccurrence, or your body is responding well to treatment, basically.
So what I'm understanding is that they do operate on kind of completely different time frames. Okay, that's very helpful. That's very helpful. Yeah, I think those are about the questions that I have and that have been sent to us by some patients. Is there anything that you think people really need to know about this test or about this technology that we haven't had a chance to talk about?
I think it's really important to note that, this testing, so ctDNA testing, it's not looking to replace the traditional testing that's done. So, CT scans, CEA tests, it's more so looking to supplement these testing. So it's a test that can detect reoccurrence, earlier. It's a test that has a higher reliability. So I would say that it's a test that can, benefit patients, but we do have to consider the cost of it. So it does have, benefits, but the cost can be, I guess, a barrier for patients. So I would definitely say that it really depends on the patient, and it could be beneficial for some patients, but it might not be beneficial for all patients.
Right. And as the policy landscape evolves, it might become more accessible for more people as well.
Mm-hmm.
Yeah. Great. Well, thank you so much, Patil. That was a very efficient talk through a pretty complicated topic, so I appreciate your expertise and your insight. And to anybody watching, if you want to learn more about this, again, you can check out our webinar on the 14th of March, which is a Thursday from 7 to 8 p.m. Eastern Time, hosted by the president of CCC, Barry Stein, with Dr. Minetta Liu and Dr. Michael Raphael. There will be a link to that below, and probably hovering above my head right now. Patil, thank you again for joining us. Where can people find you if they have questions for you?
If anyone has any questions for me, they can, email me at patilm@colorectalcancercanada.com. So that's PATILM at colorectalcancercanada.com.
Great. I have been Carl Binman here for Colorectal Cancer Canada, and if you have any questions beyond the scope of this conversation, absolutely reach out to us, colorectalcancercanada.com, support@colorectalcancercanada.com, info@colorectalcancercanada.com, or Colorectal Cancer Canada on the various social medias. Thank you so much for watching, and I hope you have a great day, Patil, and I hope you have a great day out there in the world.
Thank you.